It's interesting that most people simply don't understand how the Canada Health Act works. In fact, I was reading a CBC article a couple of days ago that said things like the Canada Health Act prohibits charging for an essential medical service like primary care that's publicly available. But in fact, essential medical services can be provided privately if they're done by, say, non participating physicians. It also said that Quebec physicians can choose between the public and private systems, but it's not the case in most other provinces. But in fact, that is the case in all provinces except Ontario. And in fact, there's a tendency, an interesting tendency, to see Ontario as a standard for what is the case. But in fact, it's actually quite the outlier when it comes to private health insurance. So, basically, if journalists can't get it right, it's hardly surprising that the rest of us are fairly confused. And, to be fair to journalists, the landscape is incredibly complex, and my head still hurts when I try to unravel some of these things. So, to explain how things really are, which again is a lot more complicated. Well, let's go back again in history, but let's go back to Saskatchewan in the early 1960s. So when Saskatchewan tried to enact Medicare, so Medicare, public insurance for physician services, right? And when Saskatchewan tried to enact this in around 1962, the doctors immediately went on strike for like 3 weeks. Hugely acrimonious affair. And it's kind of interesting why that was the case. So in Saskatchewan, as was the case in many provinces, who were the doctors? With a lot of the doctors, about in Saskatchewan, I think maybe a third of the doctors at the time were British. And why were so many doctors British? It's because they were leaving a system that had become essentially nationalized, right? So the National Health Service was set up in about 1947. And a lot of doctors, on principle, thought they'd just become slaves to the state, didn't want it. So they thought, well, let's go to a country where we're free to practice how we want. A lot of them ended up in provinces like Saskatchewan. And then all of a sudden they're facing exactly the same thing. So of course they're absolutely furious. And it was a real powder keg. So that was the context. And so they went on straight, dragged on for 3 weeks or so. And when Saskatchewan decided, well, we have to calm the doctors down. How are we going to get them to agree to Medicare? What they said was that those physicians who wanted to practice Medicare outside of the public system could do so, right? That's fine. You can, if that's what you really want, then, fill your boots. And essentially, this provision was duplicated across most provinces as well. I think Quebec also had a doctor strike around 1970, and again, doctors were offered more or less the same kind of deal. Okay, if you want to work outside the system, here you go. You know, some provinces, like I think New Brunswick, even protect this right, the right for doctors to work outside of the public system. They protect this right in legislation. So essentially, we have two healthcare systems working more or less in tandem, right? So first, there's the single tier system of healthcare that has existed more or less for the past 4 decades. When we think of Canadian healthcare, we think single tier healthcare. We don't want that, that stinking two-tier healthcare system. But in fact, there's always been this, if you wish, this shadow two-tier system, insofar as legally, physicians have always been able to provide care privately, excepting Ontario since 2004 when they passed the Protection of Medicare Act, I think. So this has always been the case. We've always had this other, so if, as I've said, this shadow two-tier system. So the question then becomes, well, okay, so why are we only now seeing this in practice? And the problem, again, is that the Canada Health Act is firmly grounded in 20th century healthcare models, which are, again, increasingly obsolescent. And most specifically, the Canada Health Act assumed that all healthcare would continue to be provided by doctors and in hospitals. And the problem is this isn't the case any longer, right? So, for example, you've got nurse practitioners, you've got pharmacists, paramedics, physiotherapists, prescribing nurses, and so on, all of whom have much expanded scopes of practice. And of course, it varies from province to province. I know in Nova Scotia, where I live, paramedics can sedate patients and essentially, fix broken bones. Physiotherapists can uh, ask for diagnostic tests. Prescribing nurses obviously can prescribe. Paramedics can diagnose, so on and so forth. So we've got these expanded scopes of practice, which are rolling out differently across all the provinces, and started before COVID, but we're really seeing this a lot more post-COVID, and governments like it because, as we know, doctors can be a bit pricey, and other healthcare professionals can do a lot of the same things a little bit cheaper. And in fact, if you actually look at nurse practitioners' scopes of practice, again, they vary across provinces, but in a number of provinces, including my own, they can pretty much do everything, all the regular stuff that GPs can do, but they can do it a lot cheaper, right? So, of course, provincial governments like that. But the problem here is the way that all of this intersects with the Canada Health Act. So, what the Canada Health Act does is to tell provinces, you decide which services you want to insure publicly. But once you've done so, these services have to be available to everyone in your province on equal terms and conditions, right? Comprehensiveness, universality. But here's the thing. This is what a lot of people don't realize. The Canada Health Act defines insured services as only those that are provided by doctors or in hospitals, right? So according to the Canada Health Act, any services, even if they duplicate those done by physicians, are not considered insured services. I appreciate some of your listeners won't see my rabbit ears here. Are not considered insured services if done by, say, a nurse practitioner rather than a doctor, right? So stitching up a cut, well, if a GP does it, then it must be publicly insured. If a nurse practitioner does it, then it doesn't have to be covered publicly, and so it can be provided privately, which is why we increasingly find private clinics staffed by nurse practitioners, where essentially nurse practitioners can, somewhat ironically, charge higher rates than GPs for the same service. And similarly, we have these non-participating physicians. Now, again, these were the physicians who told the government of Saskatchewan, we don't want part of your friggin' state run healthcare system. We want to practice. So we've got these non-participating physicians, not in all provinces, but in most provinces. Some provinces have opted out physicians. It gets a bit, again, to get weedy here. But we have physicians who are not part of the who are not enrolled in the public system. And these physicians can, in fact, provide medically necessary health care. Again, because, let's bring up the rabbit ears here, insured services in many provinces are defined as services provided by enrolled physicians, let's say enrolled in the public insurance system. And so if physicians are not enrolled, they are not providing insured services. And so these services can be provided privately, even if they're medically necessary, because they're not insured services. And again, remember that the Canada Health Act doesn't say that all medically necessary services have to be provided publicly, just insured services.
Got it.
Now,
Got it. Wow,
again, there's
that's
another angle
amazing.
here.
No, but
So
that's amazing.
I know, isn't it?
Appreciate the
And
deep
it's
dive.
incredibly complex. And you have to keep in mind that the Canada Health Act is only like 3 pages long. Well, 6 pages if you have both languages. But it's not just what the Canada Health Act says. It's also how it dovetails with all the different pieces of provincial legislation. So again, you might well ask the question, well, okay, I understand that, but why is this just why wasn't this an issue in the 70s? And the reason that this wasn't an issue for several decades is because so we tend to think that, oh, the only thing we can do to stop private healthcare is to pass legislation banning it. But that's not what we did. And, Canada has been, quite clever insofar as even in Ontario, where they have effectively banned um, public health care, but they haven't said we ban public health care. They've just defined it in such a way as to make it impossible for doctors to provide private land. I can run through that later point if you want. But so the reason that we didn't have this burgeoning private healthcare for a long time is because the constraints on private practice in most provinces rested in the fact that it was made economically unattractive to do so, right? So you can put fee caps on these. So you can say, okay, you're a GP, you can provide care privately, but you can only charge the same amount that you can only charge up to the public tariff, like what doctors who were enrolled would get. So if it's just a consultation, $35 is a public tariff, then you can only charge up to $35. Well, if that's the case, why would doctors work in the private sector if they were paid the same rates as those in the public sector? And then, of course, to the extent that again, those of us who are old enough to remember actually being able to get a doctor's appointment the next day, the same day, if you can get a GP appointment easily the next day, why on earth would patients pay more for services if you can easily get them free at point of care, right? In other words, again, private practice wasn't disallowed per se, except in Ontario after 2004. It's just that there were a lot of economic disincentives placed on it. But, and here's the problem. Of course, once primary healthcare becomes a scarce resource, which it was beginning to do before COVID, and certainly is the case now, and even again, if you have access, if you are attached to a GP, God only knows how long you have to wait before you can actually access a GP. So, primary healthcare becomes a scarce resource, and because of that, unsurprisingly, market principles, then people become more willing to pay for it. And as more and more people become willing to pay for these services, there's a larger pool of clients for doctors, right? And, so the private model actually, which has always been legal, becomes a lot more viable. And we can certainly see this in Quebec with, over 800 doctors practicing privately right now.